all feel like we're 21 inside. We don't really feel like we aged, but I'm intrigued by the way you picked the title, Be Your Best. Talk about the choice of the title, because there's 1,000 titles that could have worked for this book. Why that title, Peter?
Well, it's a question of, do you want to make yourself to live up to your full potential? And again, going back to what I said a moment ago, a person who's exercising, who's doing everything otherwise to be their best, then I think those are the prime candidates for them to be also their best as far as their appearance that we can influence with the surgical knife. So this kind of goes along with the person's being otherwise, which is availing themselves to the best. And this is what aesthetic surgery can be. But aesthetic surgery is not for everybody, because some people are just too scared. They are way too concerned about the recovery. They need to know realistically, and this is the kind of things we talk about the book, what the recovery entails, to see whether this is for them and whether this way of being their best is something that's acceptable to their psyche. When we consult on a patient in my practice, we examine their psychology as much as their anatomic features that we may be changing.
Yeah, because the worst thing you can do is to operate on the wrong patient. I'm a pilot, and I know you don't want to take off and wish you were, you'd be up there wishing you were down here in bad weather. And it's the same thing with a patient. The only surgeries I've really regretted doing in my life are ones that, in retrospect, I probably should have used my better judgment and read the patient better. Although, the flip side of that coin is some people just look as normal as can be until they go under the knife, and then they just go off the deep end.
But that's a good point, because some of us are born with an innate sense of how to screen those people out more than other people are. You can get some learning about this, how to select patients emotionally, but most senior plastic surgeons, even way back a long time ago, my professors always said, a lot of this is innate, that you're born with. And there are patients, the medical name for it is body dysmorphic syndrome, who will just have one surgery after the other one, and even if the surgery was successful, they're still not satisfied, and they go to that finite line when somebody has to say to them no more. Now, unfortunately,
would Michael Jackson, he's the person in...
It's a perfect example.
But why... Okay, Michael Jackson, let's assume for a second that his seat back is not in the fully upright and locked position.
Right.
Okay, but how the surgeons who operated on him again and again, what were they thinking?
Well, unfortunately, it's a competitive field. Somebody who with a major reputation, celebrity like Michael Jackson goes to somebody, maybe at times, unfortunately, either they don't recognize the issue, but in a situation like this, after 15 rhinoplasties, I think you have to recognize it, or they're just a little too determined to operate on anybody who walks into the door. And the last 8 or 10 of his surgeries were performed by the same plastic surgeon in Los Angeles.
It wasn't you, was it?
No.